Hello, I am Dr. Ava Brooks. Welcome back. If you have been following this series, you know that we have already covered the first 4 signs of early pregnancy, the ones that every woman should know and should never ignore. Breast changes that go beyond anything you feel during a normal premenstrual phase. A fatigue that is so profound, so bone deep, that it feels like your entire body has been quietly sedated. The strange, subtle nausea and the wild, unpredictable smell sensitivities that can turn your morning coffee into your worst enemy overnight. And implantation bleeding, that tiny trace of pink or brown that so many women mistake for an early, light period, never realizing it was actually the very first physical evidence of a new life taking hold. Those first 4 signs resonated deeply with so many of you. The comment section on that video became a living, breathing testament to how much women need this information and how rarely they receive it. Hundreds of you shared your stories. Some of you said, yes, that is exactly what happened to me. Others said something different. Something important. You said, I did not have those signs. I had something else entirely. I had symptoms that nobody ever told me were related to pregnancy. And I spent weeks, sometimes months, confused, worried, thinking there was something wrong with me, when in fact everything was exactly right. That is why I kept going. Because the female body has more than 4 ways of announcing a pregnancy. It has many. And if you only know 4 of them, you are operating with an incomplete map. You might miss the signals altogether. You might spend weeks attributing very real pregnancy symptoms to stress, to diet, to a stomach bug, to anxiety, to just being tired. And in doing so, you lose precious time. Time when your baby's neural tube is closing, when major organs are forming, when the architecture of a lifetime of health is being assembled cell by cell. Early prenatal care is not a luxury. It is a necessity. And early recognition is the key that unlocks it.so. Today, I am going to give you the signs that come after the first 4. These signs are not secondary. They are not less important. They are not weird or rare or unusual. They are common, they are real, and they deserve exactly the same level of attention and understanding as the signs we have already discussed. By the time we finish today, you'll have a comprehensive understanding of how your body communicates early pregnancy, not from a pamphlet, not from a 30-second social media post, but from the accumulated wisdom of decades of clinical practice and the real, lived experiences of thousands of women. Let us begin with the 5th sign. Frequent urination. And I need you to set aside everything you think you know about the symptom because most of what people believe about it is incomplete. The conventional understanding of pregnancy-related frequent urination goes something like this. In the 3rd trimester, the baby gets big. The big baby presses on the bladder. The compressed bladder cannot hold much urine. Therefore, the pregnant woman pees constantly. This is all true. But it is only half the story. Because the frequent urination of early pregnancy has nothing whatsoever to do with a baby pressing on your bladder. In the first few weeks, the embryo is the size of a poppy seed. It is not pressing on anything. The frequent urination is entirely hormonal and entirely cardiovascular. And it can begin within days of conception. Here is the physiology. Within the first week after fertilization, your blood volume begins to expand. This expansion continues throughout pregnancy, eventually reaching nearly 50% above your pre-pregnancy baseline. But the process does not wait for the 2nd trimester. It begins immediately. More blood circulating through your body means more blood being filtered through your kidneys. More filtration means more urine production. It is basic fluid dynamics. At the same time, the pregnancy hormone HCG increases blood flow specifically to the pelvic region, which further increases the volume of blood reaching the kidneys. And progesterone, that essential, faithful hormone that rises rapidly in the first weeks, relaxes smooth muscle throughout the body, including the smooth muscle of the bladder. A relaxed bladder is more sensitive. It signals the urge to urinate at lower volumes. It cannot hold as much as it used to. The combined effect of these 3 mechanisms, increased blood volume, increased pelvic blood flow, and a relaxed, hypersensitive bladder, is that you suddenly find yourself urinating far more frequently than you ever have before. You are getting up in the middle of the night, maybe once, maybe twice, maybe 3 times, when you have always been someone who sleeps straight through until morning. You are excusing yourself for meetings. You are mapping out bathroom locations in every building you enter. You are stopping at rest areas on road trips that you used to drive straight through. You are wondering with growing concern whether you have developed a bladder infection or diabetes or some kind of overactive bladder condition. That I had a patient, let me call her Maya, who came to see me for exactly this reason. Maya was 30 years old, a dental hygienist, and she was convinced she had diabetes. She had read somewhere that frequent urination and excessive thirst were the classic signs. She was drinking water constantly and peeing constantly, and she had convinced herself that her blood sugar was dangerously high. She came into my office braced for a life-changing chronic disease diagnosis. Her blood work was completely normal. Her fasting glucose was perfect. Her A1C was perfect. No sugar in her urine. No signs of infection. She was healthy. And she was confused that I asked her the questions I always ask. Her period was a few days late. Not dramatically, her cycles were not perfectly regular, so she had not really noticed. Her breasts had been tender. She had been tired. And yes, now that I mentioned it, the smell of the sterilization solution at work had been making her feel slightly nauseous, which had never happened before. She took a pregnancy test in my office. Positive. Just over 5 weeks. Her frequent urination was not a sign of metabolic disease. It was her body expanding its blood volume, increasing its kidney function, relaxing its bladder. All in service of the pregnancy she did not yet know she had. She walked out of my office with a completely different future than the one she had walked in expecting. And she was grateful that she had not waited, that she had not dismissed her symptoms, that she had come in and demanded an answer. So if you are noticing that you are suddenly living in the bathroom, especially if this is new, especially if it is waking you up at night, especially if it is happening alongside other changes, do not just assume you have a small bladder or a minor infection. Your body is not random. It is communicating. Listen, now let us move to the 6th sign. And this is one of the most commonly dismissed symptoms in all of early pregnancy because it mimics something else so perfectly. Bloating, gas, and constipation, the entire digestive upheaval that can accompany those first few weeks. Progesterone is a smooth muscle relaxant. That is its job. It relaxes the uterine muscle so that the embryo can implant securely and the pregnancy can be maintained. But as I have mentioned, progesterone does not confine itself to the uterus. It acts on smooth muscle wherever it finds it. And your digestive tract, from the esophagus to the stomach to the small intestine to the colon, is lined with smooth muscle. When progesterone relaxes the smooth muscle of the gut, peristalsis slows down. Peristalsis is the rhythmic, wave-like contraction that moves food and waste through your digestive system. When it slows, everything slows. Food sits in the stomach longer. Gas builds up because air that would normally be moved along is now trapped. Water is absorbed from the stool as it lingers in the colon, making it harder, drier, more difficult to pass. The result is a constellation of digestive symptoms that can begin within the first 2 to 3 weeks of pregnancy. Bloating that makes your pants feel tight even though you have not gained a pound. Gas that is socially awkward and physically uncomfortable. Constipation that resists your usual remedies, more water, more fiber, more exercise, and stubbornly refuses to resolve. And the truly challenging part is that these symptoms are almost indistinguishable from premenstrual digestive changes. Progesterone rises in the second half of every menstrual cycle, not just in pregnancy. That is why so many women experience bloating and constipation in the days before their period. So, how do you tell the difference? 2 things. Persistence. Premenstrual bloating resolves or dramatically improves when your period starts and progesterone levels drop. Pregnancy bloating does not resolve because progesterone does not drop. It continues to climb. And severity. Women often tell me that early pregnancy bloating feels qualitatively different from their usual PMS bloating. More intense. More uncomfortable. More unlike anything they have previously experienced. I remember a patient. I will call her Grace. Grace was 34, a graphic designer, and she came to see me because she was certain she had developed a serious food intolerance, maybe celiac disease or irritable bowel syndrome. She had been bloated for 3 solid weeks. Her pants did not fit by the end of the day. She had switched to loose dresses. She was constipated in a way that felt almost surreal. She had always been extremely regular, and now it felt like her entire gut had simply shut down. She had already started eliminating foods. First dairy, then gluten, then legumes. She was eating a bland, restricted diet, and she was still miserable. Nothing helped. I asked her about her cycle. She checked her app. Her period was about a week late, but she was on oral contraceptives, and she took them faithfully. She had not missed a single pill. Pregnancy had not even crossed her mind. I explained that while the pill is highly effective with perfect use, no method is 100%, and I always rule out pregnancy before launching an extensive gastrointestinal investigation. She agreed to take a test. It was positive. She was 5.5 weeks pregnant. The digestive chaos she had been trying to solve with elimination diets was not a disease. It was progesterone. It was her body slowing everything down to create a calm, stable environment for an embryo to grow. Her digestive system was not broken. It was working exactly as it should. So, if your gut has suddenly become unpredictable, if you are bloated and constipated in a way that feels new and different, do not just assume you have developed a food intolerance. Consider the possibility that your digestive system is not sick. It is pregnant. Now let's talk about the seventh sign. Mood swings and emotional changes. This is one of the most emotionally difficult early signs because it does not just affect your body. It affects your sense of who you are. The hormonal environment of early pregnancy is extraordinarily potent. Estrogen surges. Progesterone surges. HCG rises exponentially. These hormones cross the blood-brain barrier and influence neurotransmitter systems, serotonin, dopamine, GABA, norepinephrine. They affect mood regulation, emotional processing, stress reactivity. And the result is that many women in the first few weeks of pregnancy experience emotional shifts that can be genuinely destabilizing. They describe it to me as a kind of rawness, as if their emotional skin has been peeled back and everything is hitting them harder than it should. A sappy commercial that they would have ignored a month ago now makes them weep. A minor friction with their partner, the kind of everyday disagreement that happens in any relationship, now feels catastrophic. They snap at their children or their coworkers, and then they are flooded with guilt. They feel irritable in a way that surprises them. They feel anxious without a clear reason. They feel sad or overwhelmed or just deeply, fundamentally not like themselves. And because they cannot point to an external cause, they start to wonder if they are losing their grip. And as with the digestive signs, the confusion is compounded by the fact that premenstrual mood changes are common and progesterone-driven. Many women experience some degree of emotional sensitivity in the days before their period. The difference is persistence and depth. Premenstrual mood changes are typically time-limited, a few days, maybe a week, and they lift when bleeding begins. Early pregnancy mood changes do not lift. They continue. They may shift and evolve, but they do not resolve because the hormones driving them are not resolving. They are intensifying. I want to tell you about a patient named Jade. Jade was 26, a social worker, and she came to me because she was afraid she was experiencing a mental health breakdown. She had been crying every day for nearly 2 weeks. She cried when she woke up. She cried on her commute. She cried in the bathroom between client sessions. She was snapping at her boyfriend over absolutely trivial things. He left a dish in the sink and she had a full emotional meltdown, and even in the moment she knew it was disproportionate, but she could not stop herself. She felt anxious all the time, a kind of free-floating dread that she could not anchor to anything specific. She had no history of depression or anxiety. Her life circumstances had not changed. She was just suddenly, inexplicably, emotionally unraveling, and it terrified her. I asked her careful questions. When did it start? About 2 weeks ago. Any physical symptoms? She was exhausted, but she attributed that to the emotional turmoil. Her breasts were tender, but she assumed her period was imminent. She had been feeling queasy in the mornings, but she thought that was anxiety, the physical manifestation of her emotional distress. And her period? She checked. She was about 5 days late. But she had irregular cycles, so a 5-day delay was not particularly unusual. I asked her to take a pregnancy test. She looked at me as though I had completely missed the point. "This is psychological," she said. "I am having a breakdown. What does pregnancy have to do with it?" I explained that everything she had described, the tearfulness, the irritability, the anxiety, the fatigue, the nausea, the breast tenderness, formed a picture that was entirely consistent with early pregnancy. That it was at least as likely as a sudden-onset psychiatric condition with no prior history. That it would take 2 minutes to rule out. She agreed. The test was positive. She was approximately 5 weeks pregnant. And the look on her face when she understood, when she realized that she was not losing her mind, that her brain was simply responding to the most profound hormonal event a human body can experience, was something I will never forget. She was not broken. She was pregnant. Now, I want to be responsible here. Mood changes in early pregnancy are real, they are physiological, and they're usually transient. But if you are experiencing severe mood disturbance, if you feel persistently hopeless, if you have thoughts of harming yourself, if you cannot function, that is not just early pregnancy moodiness. That could be antenatal depression, which is a serious condition that deserves treatment and support. Please speak to your doctor. There is help and there is no shame in needing it. But for the majority of women, the emotional shifts of the first few weeks, while intense and disorienting, are a normal part of the process. And recognizing them for what they are, rather than interpreting them as a sign of personal failure, can be profoundly reassuring. Now, the 8th sign. Dizziness and lightheadedness. This is a symptom that can genuinely frighten women who do not know it can be pregnancy-related. In early pregnancy, your cardiovascular system undergoes a massive transformation very quickly. Progesterone causes blood vessels throughout the body to dilate. They widen. When your blood vessels widen, your blood pressure drops. A woman whose blood pressure normally runs 120/80 might find herself at 100/65 or 95/55 or even lower. At the same time, your blood volume is expanding, but the vessel dilation happens faster than the volume expansion can fully compensate for. So there is a window, typically in the first 6 to 8 weeks, when your blood vessels are wide open, your blood volume has not fully caught up, and your blood pressure is lower than it has ever been in your adult life. The result is orthostatic hypotension, a drop in blood pressure when you stand up because your dilated vessels cannot constrict quickly enough to push blood upward against gravity. This produces a characteristic head rush. Dizziness can also occur when you have been standing for a long time because blood pools in the legs and the dilated vessels struggle to return it to the heart and brain. It can happen when you are hungry, because pregnancy accelerates your metabolism and your blood sugar can dip more sharply between meals. And it can happen in warm environments, because heat causes further vasodilation. Now, I must say this clearly. Dizziness and fainting can be signs of serious conditions. Cardiac problems, neurological issues, severe anemia, ectopic pregnancy. If your dizziness is severe, if you actually lose consciousness, if it is accompanied by chest pain, shortness of breath, severe headache, vision changes, or abdominal pain, seek medical attention immediately. Do not assume it is pregnancy and wait it out. But if the dizziness is mild, positional, and accompanied by other recognizable early pregnancy signs, it is quite likely just your cardiovascular system doing what a pregnant cardiovascular system does. Adapting. I had a patient, Nina. Nina was 29, a yoga instructor, in excellent physical condition. She came to see me because she had nearly fainted twice. Once getting out of bed in the morning, once standing in line at the post office. As someone who was very attuned to her body, she found these episodes deeply unsettling. She had checked her own blood pressure and found it was significantly lower than her normal. She typically ran about 110/70, and now she was measuring in the low 90s over high 50s. She was worried about her heart. Her EKG was normal. Her heart exam was normal. Her blood work was normal. I asked her the standard questions. She was a few days late for her period. She had been unusually tired for a couple of weeks. Her breasts were sore. She had felt slightly nauseous in the mornings, but she had attributed that to the dizziness. I suggested a pregnancy test. She was skeptical, but she indulged me. Positive. 5 weeks. Her low blood pressure and dizziness were not cardiac pathology. They were the normal, expected vasodilation of early pregnancy. Her cardiovascular system was not failing. It was making room for the 50% increase in blood volume that would be needed over the coming months. This is why I want you to know about dizziness. It can be frightening. It should always be evaluated. But it is also one of the body's legitimate, physiologically normal early pregnancy signals. Do not panic, but do pay attention. Now, I have given you 4 more signs. Together with the first 4, that makes 8. But I want to give you a few more. Not with the same depth, because we have limited time, but with enough clarity that you will recognize them if they appeared at the metallic taste in the mouth. Dysgeusia. It is strange, it is unpleasant, and it is surprisingly common in early pregnancy. Women say it tastes like they have been sucking on pennies, or like there is a piece of metal resting on their tongue. It is hormonal, particularly related to estrogen, and it usually fades as the first trimester progresses. Headaches. The shifting hormones, the increased blood volume, the changing blood pressure. All of these can trigger tension headaches or migraines in the first few weeks. If you are prone to headaches, they may intensify. If you have never had headaches before, you might suddenly start increased vaginal discharge. Thin, milky, mild smelling. It is caused by the increased estrogen and the increased blood flow to the cervix and vaginal walls. It is normal. It is not an infection. It is your body creating a healthy environment, nasal congestion and nosebleeds. The increased blood flow that affects every part of your body also affects the delicate mucous membranes in your nose. They swell. They become fragile. You might feel stuffy, congested, as if you have a mild cold that never quite develops. You might have a nosebleed out of nowhere. This is pregnancy rhinitis, and it is more common than most people realize. Skin changes. Some women develop acne as hormones shift. Others get the famous pregnancy glow, increased blood flow to the skin creating a radiant, flushed appearance. Some women notice darkening of the skin along the linea alba, the line down the center of the abdomen. These changes can begin in the first few weeks, food cravings or aversions beyond nausea. A sudden, intense desire for a food you normally never eat. A sudden, complete revulsion toward a food you have always loved. This is your brain's reward system being reshaped by pregnancy hormones. None of these, alone, is proof of pregnancy. But together with the major signs, they complete a picture. They give you more data points. They help you listen to a body that might be speaking in a dialect you have not yet learned. Now I need to say something important directly to the women who are trying to conceive. The women deep in the 2-week wait, analyzing every sensation, hoping for signs. You must understand that the symptoms of early pregnancy and the symptoms of the luteal phase, the days between ovulation and your period, are nearly identical. They are caused by the same hormone, progesterone. Whether you conceived or not, progesterone rises after ovulation. It makes your breasts tender. It makes you bloated. It makes you tired. It affects your mood. So, experiencing these symptoms in the days before your expected period does not confirm pregnancy. It confirms ovulation. It confirms that your body produced progesterone, which is exactly what it should do every cycle. Please do not torture yourself with symptom analysis. The only reliable answer is a test. And for those of you watching who are not hoping for a positive test, who are worried, who are scared, who are facing something you did not plan for and do not feel ready for, I want you to know that my care and my respect for you is exactly the same. You deserve accurate information. You deserve compassionate, non-judgmental healthcare. You deserve time and space to think, to feel, to decide. Whatever you choose, whatever your circumstances, you matter. And you are not alone. Here's what to do if you recognize these signs. First, take a home pregnancy test. Use first morning urine. Follow the instructions exactly. If positive, call your doctor. If negative but your period still does not come and your symptoms continue, test again in a few days or request a blood test. Second, begin a prenatal vitamin with at least 400 micrograms of folic acid immediately. The neural tube closes between day 21 and day 28 after conception, often before you know you're pregnant. Folic acid during this window dramatically reduces the risk of neural tube defects. Do not wait for your appointment. Start now. Third, eliminate alcohol. Stop smoking. Avoid recreational drugs. Fourth, review every medication you take with your doctor as soon as possible. Fifth, take care of yourself. Eat. Hydrate. Rest. Your body is doing something extraordinary, and it needs your support. I want to close with something I believe deeply. Your body is your ally. It is not your enemy. It is not a problem to be managed or a machine that randomly malfunctions. It is an ancient, sophisticated, miraculous biological system that has been shaped by millions of years of evolution to do something almost unimaginably complex. It builds a new human being from scratch, and it communicates with you while it does it. In tenderness and fatigue, in nausea and dizziness, in mood shifts and digestive changes, in the sudden, inexplicable urge to urinate and the strange metallic taste in your mouth. These are not malfunctions. They are messages. And you can learn to read them. My name is Dr. Ava Brooks. I am an older woman and I am a physician. I hope this series has given you something lasting. Not just a list of symptoms to memorize, but a deeper trust in your own body, a willingness to listen when it speaks, and the confidence to act on what you hear. Take care of yourself. Trust your body. I will see you next time.